Hey, Eric, how are you?
Thanks. I just have a question for you. So yesterday, you're quoted in the Globe as saying, if elected governor, you look to cut 5,000 state jobs, particularly from the Department of Health and Human Services. And as a state employee myself within the Health and Human Services Department, I'm curious as to where you think those cuts can be made, and why is it that 10 minutes ago you were discussing job creation as being an initiative you were pursuing, but likewise are willing to cut at least 5,000 jobs of people who need them?
If you take Health and Human Services as an example, many agencies, all working in many cases at cross purposes with one another when they're supposed to be serving the same populations and trying to leverage their ability to actually create kind of a comprehensive approach to taking care of their needs. And this isn't just a Republican thing. I mean, I read a pretty good report that was written by a group called, I think, the Center for Law and Social Policy in 2004 that said Health and Human Services was so complicated and so difficult to penetrate administratively that many families that have, issues and problems and need Health and Human Services couldn't actually figure out how to get to the people they needed to talk to or the parts of the organization they needed to work with to get stuff done. And the more complicated the family was, the more difficult it was to actually navigate your way through Health and Human Services. And by the way, I don't think that's just a Health and Human Services problem. I got asked to give an example, and I gave that one. I think it's true across state government. And I think it's time, instead of just consolidating line items, I think we should start thinking about consolidating agencies.
Erica?
If you don't mind my asking, what programs or areas do you think can withstand cuts and the same level of services still be delivered?
I actually think, Erica, you can deliver better services if we had fewer administrative structures in place.
What do you think, Erica?
Well, I think that, there's no guarantee that I may not be one of those 5,000 people, and then I'm back in the private sector and facing, possible unemployment. And where do I go from there? I guess across the board, it seems that state employees can be an expendable cut when...
Let me ask you a question, Erica. There are lots of people in state and in local government, and there are lots of people in the private sector who took big reductions in their salary and their wages over the course of the past 2 years. Big ones. I know cities and towns where people negotiated 5%, 7%, and 8% reductions across the board in what people got paid. I know people who lost 10, 15, 20% of what they were getting paid in the private sector. Do you know anybody in the state government who actually was negotiated through a reduction of anything like that?
Absolutely, I was.
Okay, well, that makes you the exception to the rule.
I took a pay cut, and I've witnessed management, take extensive furloughs, and I think everybody's been hit, and we all sort of understand that. So, yeah, I did.
Okay, well, I think that makes you, I'm glad you did that, and I think that makes you the exception to the rule, based on my understanding of what took place.
All right, Erica?
Well, thank you very much, Mr. Baker, and thank you very much, Pat, for having me on.
Not a problem.
Take care.
Yeah, bye-bye now. I know we're out of time, Charlie, but I do want to thank you for coming on, and it was on short notice, and I look forward to more conversations with you.
We'll try and do it in person the next time.
Absolutely. I look forward to it. But thank you and thank your staff, because it was arranged very quickly, but I do appreciate it, and I enjoyed the conversation.
Take care.
You as well, sir. Thanks, Charlie. Yep, bye-bye.